Hello, my name is Karen. I'm a nurse specialist for the Lung Defence Service at Papworth Hospital. These video guides have been designed to help patients self-administer intravenous antibiotics at home. Being able to self-administer IV antibiotics in the comfort of your own home offers you freedom and flexibility. The nursing team will train you in all aspects of administering your treatment at home, or in some cases they can train a relative or carer. These videos are to complement the training you've already received from your nursing team. In some cases the processes may vary. If you're unclear of any of the processes and need more information, please contact your nursing team. They are there to offer you support, guidance and advice whenever you need it.
This is Ryan, who, step by step, will show you how to confidently and safely prepare and give your IV antibiotic. When preparing and giving your IV antibiotics, it is crucial to reduce the risk of infection. Use a plastic tray to prepare your IVs on. Give your work surface a good clean using disinfectant wipes or a disinfectant spray with a clean paper towel. Make sure you clean it thoroughly. Now wash your hands using soap and water. Follow the 6 stages of hand washing we showed you. When finished, turn off the tap. Do not use your hands so they stay clean, and then dry them thoroughly with a paper towel. After removing the medication from the fridge as instructed by your nurse, you need to check it. First, remove the sodium chloride flush from its package. Discard the packaging. Now carefully read the label. Is it the right medication? Check the expiry date. Now remove the antibiotic infusion device from its packaging and do the same checks. Double check the details. Place the medication down in the order you'll use it. Do the same checks with the heparin flush. If everything is okay, place 2 alcohol wipes at either end of the tray. Now you must check there are no air bubbles in your syringes. First, with the sodium chloride flush syringe, twist the cap, push in the plunger and break the seal. When the fluid reaches the top, air is expelled. Now close the cap and you're ready for the next stage. Next, inspect the tubing on your infusion device. You're looking for any kinks, leaks or damage. And then you need to prime it. Loosen the protective cap, then open the clamp on the tube, allowing the tubing to fill. When you can see the fluid appearing at the end, it's primed and ready to use. Now close the clamp and turn and close the protective cap. That's your infusion prepared. Next, check there are no air bubbles in the heparin syringe. Remove the protective cap and push the plunger. When you see a tiny drop of fluid at the tip of the syringe, all the air is expelled. Now, using the non-touch technique, screw the cap back on. Your preparation is done. Now wash your hands again. For the next stage, you can move to somewhere you feel more comfortable. An armchair will do. Remember to have your sharps bin close by. Next, roll off your bandage and unfold the gauze, freeing up the bionectar inside. But before you proceed, you need to check around the venous access line, looking for signs of infection, for redness or swelling. Is the area tender? If so, tell us as soon as possible and do not under any circumstances give your medication. However, if everything is okay, then carry on. It's very important you first clean your bionectar. Taking an alcohol wipe, clean the end thoroughly for 20 seconds. Then let it dry for 30 seconds. Now we need to flush the line. Pick up your sodium chloride flush syringe and remove the cap, making sure you don't touch the end. Now attach it to the bionectar. Next, slide open the clip on the line and slowly push the plunger to inject the amount of flush you've been shown. Once done, remove the syringe. Screw the protective cap back on, pop it back on the tray, keeping hold of the bionectar with your free hand. Now you're ready to give the antibiotic infusion. First remove the cap, carefully holding the ends of both the infusion tube and the bionectar like this. Attach them. Next, open the clamp on the infusion tube and then sit back and relax. When finished, the infusion bags should be empty like this. Now close the clamp and detach the infusion device and dispose of it in your sharps bin. Once finished, you must now flush the line twice. Attach the sodium chloride flush syringe, push in plunger and give all the remaining flush. Disconnect it and place the empty syringe in your sharps bin. Now remove the protective cap from the heparin flush and attach the syringe to the bionectar and begin to give the flush. The next bit is very important. As the plunger almost reaches the end, take hold of the clamp and start to close it whilst continuing to push the plunger. When the flush is finished, only then close the clamp completely. Now disconnect the syringe and place it in the sharps bin. This technique prevents the line from becoming blocked. Now, using an alcohol wipe, you need to again clean the bionectar for 20 seconds. Then wrap the line back up in the gauze as you've been taught and roll up the bandage. Now tidy away. And that's it. You've given your antibiotic. Well done. But don't forget, afterwards, always wash your hands.